Throughout history, freethinkers have outraged the religious with their wacky ideas about the virtues of free speech, reason, and of course, eating babies. Now, God is dying, and it's time to dispose of his remains. From the pits of hell, Satan sends two puppets of the imperialist West and the Zionist Jews against God, Islam, and tiny kittens to bring you their propaganda and conspire for a new world order. This is Secular Jihadists for a Muslim Enlightenment with Ali Rizvi and Armin Navabi.
All right, everybody. Welcome to another episode of Secular Jihadists for a Muslim Enlightenment. My name is Ali Rizvi, and with me is Armin Navabi. Armin, how are you tonight?
Not bad. Thanks.
We've gone from fine to not bad. That's okay. But anyway, so I'm going to get straight to it and introduce our guest because today we have basically an hour and we want to be respectful of his time. And he's just a treasure trove of information when it comes to the topic that we're discussing today, which is about male circumcision. So as you know, male circumcision has been in the news recently. There has been Iceland is considering a motion to ban all male circumcision, which has caused the usual outrage from some of the religious and cultural groups, like Jews and Muslims mainly. So it has become controversial. They insist that it's not because of it's not anti-Muslim or anti-Semitic. It's for the children. It's for the autonomy of the child and for them to be able to make their own decision when they grow older. So so today we invited Brian. Is it Earp or Arp? How do I pronounce it?
It's Earp, the first one, yeah.
Oh, the first one. Okay, so yeah, I should have asked you that before. So
that's all right.
Brian, yeah. So Brian Earp. So Brian is actually he's in my view he's an authority on this, and he's written some of the most he's actually written some of the most educational literature on this. So Brian is the associate director of the Yale-Hastings Program in Ethics and Health Policy at Yale University and the Hastings Center Bioethics Research Institute. And he is also a research fellow in the Uehiro Center for Practical Ethics at the University of Oxford. He's got degrees from Yale, from Oxford, and from Cambridge University. His work is cross-disciplinary. So he has training in gender and sexuality, in philosophy, psychology, history, and the sociology of science and medicine, and ethics. His research was cited in the U.S. President's Commission on Bioethics and in a landmark British High Court case concerning FGM, female genital mutilation, by Sir James Munby in the matter of B&G. In 2016, he was invited by the Royal Netherlands Academy of Arts and Sciences to serve as one of a small group of high-level experts reporting the Dutch government on research methods and quality control in science and medicine. And he later served as a peer reviewer on the final report. He was also invited to submit materials based on his work on female and male genital cutting to a special committee of the European Parliament. And this work was published as part of a monograph series produced by them. Currently, he's the associate editor of the Journal of Medical Ethics. He's the associate editor for the Yale Journal of Law and Humanities, ethics editor for the Journal of Clinical and Translational Research, and he sits on the board of editorial consultants for Public Affairs Quarterly. And he has many publications that you can go and you can search on.
You could just summarize all that by just saying he knows what he's talking about.
Well, here's why I wanted to read all of that stuff out is because there's so much misinformation out there on this topic, on genital cutting, on male circumcision, on FGM, on the cultural and religious attitudes around it, and especially the focus on the ethics. That I wanted to really drive home the fact that who we're talking to here, Brian, is actually he's, in my view, again, an academic authority on this, and that has been recognized around the world. So we're actually really honored to have you here, Brian. Thank you for coming on the podcast, and I'll stop talking now.
Well, thanks for having me on and for that incredibly embarrassing introduction.
Of course, yeah. That's what we do. That's what we do here. Yeah. I'm embarrassed. So Armin has the first question, which is the most common question that we get when we talk about male circumcision. So we're just going to dive in. Armin, go for it.
Right. A lot of people mention that, when you have FGM, when you have female genital mutilation, which is a lot more harmful, a lot more disgusting. That's a much bigger problem. Why do we even bring this up? This is nothing compared to what girls go through with FGM, and that's a problem that everybody needs to be focused on. Everybody needs to focus on, rather than this thing that seems to be not as damaging or not as harmful as FGM.
Right.
Well, I definitely think focusing on female genital cutting is an important goal, and any conversation about male circumcision definitely should not detract from that. But there's a bit of a complication here, which touches on the Iceland proposal to, as you said, ban male circumcision, which is that what the World Health Organization defines as FGM, female genital mutilation, refers to actually a very wide range of practices. Most people think about the stereotype of removing the external clitoris. That's what they equate in their minds with FGM, but that's just one version of the practice. There are other forms that are relatively less invasive. So there's something called a ritual nick, which is FGM type 4 on the WHO typology. And this is a procedure that doesn't remove any tissue. It's essentially a prick to the foreskin of the clitoris, so the clitoral hood. And this is far less invasive than male circumcision and is illegal in Iceland and in other Western countries. So the concern is that if you have a practice that is, on any view, less invasive than another one, and it's prohibited partially because of the view that it's harmful, even though it's relatively slight, there's a sort of problem with the law in terms of consistency that these legislators appear to want to fix. In fact, they're not proposing a new law. What they want to do is just change one word in the existing law says anybody who, for non-medical reasons, cuts a girl's genitals for no matter how slight or for religious reasons or otherwise, will face criminal consequences. And they just are proposing to change the word girl to child. So this would include boys on the same grounds that are already present in the law. So that's kind of the reason why this is creating a legal conflict. But in terms of the damage that can follow from male circumcision compared to female genital cutting, it's not a matter of weighing up which is more harmful and trying to have a kind of competition in that regard, but it depends on which version of which practice you're talking about. So with respect to male circumcision, I think most people in this conversation are probably thinking of a sort of westernized, medicalized circumcision if they're from the US, or maybe Jewish or Muslim ritual circumcision carried out, around infancy in the case of Jewish circumcision, or sometimes later in Muslim circumcisions. And that seems like a relatively benign procedure. There's debate about that, but that's the general view. But if you were to go to South Africa, where I'll be next week giving a talk on this topic, and you were looking at the practice of circumcision among the Xhosa tribe, there are dozens of deaths per year because there it's done out in the bush with non-sterile equipment, and you have infections and penile amputations and a very high death rate. And so that's actually the most dangerous form of genital cutting, is male circumcision in this African context. So that's just to give some sketch of the territory, and you can kind of go from there.
So if there's less harmful version of it, would it be better for us to not completely say this is wrong and instead encourage the less harmful version of it? And if there is less harmful version of it, that you're saying that they're not that harmful, what is the problem with that? Why can't we just encourage people to do the less harmful version of it instead of just completely removing this whole thing?
Yeah. That's been proposed a couple of times. So the American Academy of Pediatrics back in 2010 was aware of the fact that their no-tolerance stance against all of non-therapeutic female genital cutting were going to run into some tension with their tolerance of male circumcision. And so in order to even up the score, they proposed allowing this ritual nick, this least worst type of so-called FGM. And they were met with outrage and outcries and protests and so forth. And so just a month later, they retracted the policy and said, never mind, it's still zero tolerance. No form of female genital cutting, if it's not required for medical reasons, should be allowed.
I refer people to that action by the American Academy of Pediatrics frequently, because many times they talk about, well, the American Academy of Pediatrics says there's more benefits to it than harm. And I always let them know, I'm like, well, they're not just going with the science and the medical, good science and good medicine. They have actually greenlighted a form of FGM in the past in 2010, where they greenlighted this ritual NIC, the WHO Type 4 FGM, and they didn't do it for scientific reasons. They did it because of cultural reasons, because they didn't want the girls to be taken overseas, and they wanted it to be done safely. So it wasn't really there wasn't any scientific basis or any health benefit.
But isn't that
driving the decision?
Isn't there a health benefit? If you think that you're suggesting a health benefit that nobody is going to like a lot of people are not going to agree to, so the whole thing might be a mess. Instead, suggesting something that is still better, but not completely outlaw something. So that is still within the interest of the health of the girls, because maybe you think that you could not, if you completely ban it, it's not, people are going to resist that. I mean, we said it's because of the protesters, but my question is that, do you agree with those protesters? Do you think that they are right to demand all or nothing?
I think there's a question of what the role of doctors should be in essentially playing the role of cultural brokers. So the American Academy Pediatrics, if you look at their mission statement, is to protect and preserve the health of all children. And you might say there's a practice that's harmful, and people might do a more harmful version of it unless we do a less harmful version of it. But this is to sort of mix up the role of doctors, which are there to promote health, and sort of cultural officials, which are there to sort of protect the spiritual welfare of children, which is not a matter that doctors are expert in. So I think there might be a conflation of roles that's a little bit troubling. In terms of whether it would be best to do this sort of minor form rather than have girls taken overseas, which is the alternative that's sometimes raised, I have a couple of thoughts about this. The first is that when the AAP talks about harms or risks, they tend to be thinking of a very specific notion, which is essentially surgical complications. So if you try to do a prick or a nick to the clitoral foreskin, the risk of certain types of surgical complications is relatively low, but it's not trivial. And the magnitude of the risk, in other words, the badness of it, is something that you can imagine an individual girl growing up and saying, I actually don't want to incur any kind of risk with a knife around my clitoris, particularly when I'm a baby and the target is very small. So it doesn't take a lot of error to have a slip of the scalpel, and suddenly you've done more nerve damage than you intended to do. So when people say, well, it's a minor procedure, what they mean is relative to other things, it's not quite as invasive, and it's not, the intention isn't to remove tissue or to damage nerve endings. But the risk of that is certainly there. And I think it would be perfectly reasonable for a person to say, this is the most private, intimate part of my body with profound psychosexual significance. My tolerance for risk is actually zero. Rather than some small amount that somebody else decided was, a tolerable amount of risk when it comes to a knife near my genitals.
So I wanted to get back to, first of all, I just wanted to make it clear for the audience, for people who don't know, is that just in terms of the amount of tissue that is removed in a male circumcision, it's up to between 33 and 50% of the penile skin, a functioning penile skin. And we used to get these specimens I used to work as a pathologist, and we used to get these specimens in the path lab, and they were pretty big. It was, I think a couple dozen square centimeters or more. So it is a significant amount of functioning skin that is removed in completely healthy newborns. And we're not talking about medical conditions here. So,
just one quick thing about that is that so I'm from the U.S. where, this is not Iceland or Europe where it's strictly a religious practice. It's a pretty common practice in the U.S. as many people know. And here you hear as part of the general discourse that circumcision is just removing essentially a little bit of skin. And the problem here is that they're talking about the infant's penis, which is very small. And so it indicates that you're have a very, again, diminutive target here where it's easy to make a mistake, and you won't know until later because obviously the body changes over the course of development. But what you're talking about is the adult equivalent of what's removed. So if you don't perform a circumcision and you just let a kid grow up with his genitals all in one piece, the amount of tissue that will be preserved in the adult is about 30 or 50 square centimeters of tissue. And it's the most touch sensitive tissue on the penis. That's been demonstrated now twice by objective studies. So
there was a BMJ study I saw that said that the 5 most sensitive areas on the penis are actually on the related to the foreskin. So one thing that you've advocated for is you've advocated for using gender-inclusive terminology when we talk about genital cutting. So, people say, well, it's FGM, but what about male circumcision? People talk about male circumcision. Well, why don't we focus on female circumcision or FGM? So, can you talk a little bit about that? Why should we be just talk about infant genital cutting rather than dividing into male and female babies?
Well, one reason is that people tend to forget about the case of intersex children, which are children with ambiguous genitalia that are neither clearly male nor female. And the problem here is that you have a case where a relatively small penis, which would be an ambiguous or intersex case, would be legal to cut, whereas a relatively large clitoris, which would be sort of the other side of the spectrum converging toward the middle, would be illegal to cut. And that's the current situation of the law. So there's no just strict dividing line when you're looking at an intersex child as to whether it's a large clitoris or a small penis. It's the very same tissue embryologically, and then it develops and it gets sort of stuck in the middle in these cases. And so it's just a judgment call as to whether you're cutting male tissue or female tissue in that case. And the thought that on the one side of that, it's totally prohibited, and on the other side, it's totally permitted, just creates, again, a very embarrassing situation for the law. The sort of one of the main reasons why people are rightly concerned about FGC or FGM is that you're performing an irreversible procedure on a person who can't say no, who doesn't have the wherewithal to resist. And it's often talked about as a sort of expression of male dominance or patriarchy, which is a conversation we could get into. The reality of the cultural norms behind female genital cutting is very complicated and depends on what group you're talking about. But the sort of feminist concern there that I think is right is that it's about an unjust asymmetry in power, where those in power, men in a patriarchy, are unjustly exercising that power over others. And I completely agree with the critique that unjust power is the concern. And the reason why I talk about sort of gender neutral claims is that an infant is completely vulnerable regardless of their gender. And so if your concern is about people who have power taking actions about people who can't defend themselves against those decisions, that's something that applies to children across the gender spectrum or the sex spectrum, depending on how you want to parse it.
Yeah, and one more thing, just from a legal standpoint, if we are making arguments defending male circumcision, like legal arguments, parental autonomy and all those, then when people want to defend FGM, can't they make the same argument? So if we talk only about, say, male circumcision is okay, but we really need to go legally after FGM, then doesn't that put them into a bit of a legal quandary in the sense that, anything that they say about FGM, that this is, it's invasive, it's irreversible removal of tissue, it's a right of the, or whatever arguments that there are currently against FGM, can't we just point to male circumcision? Well, this procedure is legal and does the exact same things from legal standpoint.
Well, so that's precisely what's happening from two different directions. One is that defenders of ritual or religious male circumcision have again realized that there's a collision in the law, that if male circumcision is completely protected and all forms of non-therapeutic female genital cutting are prohibited, that male circumcision looks like it's next in the firing line. And so as a preemptive measure, what some of these defenders of male circumcision are doing, some of them are scholars, are putting papers now into the medical ethics literature, positively arguing the permissibility of what they consider to be minor forms of FGM. So they're saying, listen, folks, parents have the right to make decisions about their children and to bring them up in terms of their religious beliefs and their cultural preferences. And, male circumcision is obviously permissible, and therefore we should certainly permit, relatively minor forms of female genital cutting. So on the one hand, you have defenders of male circumcision making now positive arguments for FGM to try to create a buffer of essentially leaving male circumcision unquestioned. And now on the other side, you have defenders of female genital cutting borrowing directly from the male circumcision playbook to bolster and support their own favorite practice.
And how do you respond to it if somebody says, like, listen, who the hell are you to tell me what to do with my child? This is my child. I'm the parent. I get to decide. Or people that say this is our religion. You're not being accepting of our beliefs. This is insulting. How do you respond to those two claims?
Yeah, well, it's it's certainly true that parents are granted a very wide latitude in bringing up their children according to their best judgment, and it's also true that states justifiably place certain limitations on the sorts of things parents can do to their children. So parents don't have a blank check, obviously, to treat their children's bodies or upbringing in any way they please. And so what you have to do is just look at the current law with respect to other kinds of practices where society has decided that there should be some protection for the child who is vulnerable. Obviously, most parents love their children and want to do what's best for them. But you don't have to get, you don't have to have any particular skills to become a parent. You don't have to necessarily have thought through whether what you're doing may be considered harmful from another perspective. And so on a societal level, there are some agreements about what those limits should be. So just one example, it's not permissible in most U.S. states to tattoo a child's body. If the child's under 18 and you authorize this as the parent, this happened in Georgia a few years back, you'll be able to, even if as the parent you think it should be fine for your child to have a tattoo. Now this leads to some absurdity when you triangulate from these cases to the case of male circumcision, which is that if you wanted to tattoo your child's foreskin, you would be arrested under most state laws as a form of child abuse, essentially. Whereas if you were to first just cut off your son's foreskin and go tattoo it over there, that would be perfectly permissible under the current law. So the situation is just, you have to decide where you want to draw the line. And that's certainly a fair debate. People can say, listen, the guy who was in the AAP committee, the bioethics committee that argued in favor of minor FGM, Douglas Dykema, who also was on the AAP policy that was relatively favorable toward male circumcision. He's famous within the bioethics community for arguing for something called the harm principle, which is essentially, it isn't the case that parents should have to do what's in the best interest of their children. It's just that they should be allowed to harm them, put them at serious risk of significant harm, whatever that means. And what you find out is that nobody knows what that exactly entails. And on his view, parents should have essentially unfettered right to decide what's best for their children. Other people think that children are vulnerable and need, some protection.
But then when you mention harm, a lot of people will respond like, listen, I've been circumcised. I'm totally fine. I don't know what you're talking about. This is, everything is okay, and I don't see what the big deal is. Like,
I was gonna, before you go ahead with that, Brian, I'll just tell them my usual response to that when people say it. I always tell them it's like listening to, well, this is depending on your musical taste. It's like listening to Led Zeppelin, without the rhythm guitar and the bass. Your whole life, you're still gonna love it because it's Led Zepp. It's amazing music, but you're just never going to hear the rhythm guitar and the bass, and you'll never know it. Or it's like, I guess listening to Beethoven without the strings.
So are you referring to the sexual pleasure loss from this? Is that what you're referring to? Is that the main harm here?
Well, so there's different ways of answering this question. Another analogy that some people raise is that, sexual experience without a foreskin compared to with it is sort of like being colorblind. You can certainly enjoy life and have a wonderful, fulfilling existence, but some aspect of your experience is missing. In the case of people who say, I'm perfectly fine, I don't feel harmed, there's a couple of things to say about this. One, it's not my goal to make people who feel perfectly happy about their circumcised bodies to suddenly feel horrible and mutilated. I don't think that would help anything about this situation. But I do want to treat seriously the voices of those who have had serious dysfunctions and complications and problems as a result of their circumcisions, who do indeed feel harmed, and just explain why someone might feel harmed. So here's one reason. You mentioned a study in the BMJ. I think it was BJU International, if I'm remembering correctly.
I know, you're right. It's a BJU. Yeah, I was acronym dyslexia. Sorry.
Yeah, that's all right. And there was a more recent study in the journal Urology by Jennifer Bosio and her colleagues, where what they do is they take a filament and they press down on different places on the penis to see when objectively you can just feel the pressure. And then they have a little measure where they can mark off exactly how much force has to be applied until you can detect that application of pressure. And this is now the second study to show that the foreskin is the most sensitive part of the penis to light touch, and it's more sensitive than other parts to mild sensations of warmth. It's also essentially an elastic sheath of tissue that interacts with the other parts of the penis. It rolls back and forth. It has certain properties that people who have this tissue tend to find valuable. And so you might think, well, listen, light touch and light warmth, who needs these kinds of things? That's not what's important for male sexuality. It's all about whether you can get an erection and have an orgasm. And I think that's actually pretty telling that people feel like, well, as long as I can do those things, I'm perfectly okay. I think there are a lot of shades of male sexuality that are potentially missing when you remove this very delicate tissue, this tissue that's highly sensitive. And I think some of the reasons why we think of male sexual experience as being this sort of hammering, thrusting kind of masculinized activity that some people, again, rightly critique, is because, at least in the United States, men have had the most sensitive part of their genitals removed. And so what's left is an experience that is certainly enjoyable. It's
you
not
need a higher threshold, though.
Yeah, it's just a different experience. And so, when another thing to say about this too, to answer your question, is when people say, well, I'm circumcised and I'm okay, you have to consider what their understanding is of the alternative. So in the US, we're basically socialized that circumcision is just a little snip. What gets removed is a foreskin, whatever that is. And this is a preferable way of being. So how could I possibly consider myself as harmed? But if you go to Europe or most other places on earth where circumcision is not the norm, and you ask men with intact genitals, hey, how would you feel about being circumcised? The foreskin, who needs that, right? It's just this sort of silly bit of skin that causes health problems, right? And they'll just laugh in your face. I mean, they'll say, what? Why? I would never consider getting rid of this tissue. It's a very important part of my body. And so I think a lot of the "I'm not harmed" rhetoric comes from the fact that people are basically just ignorant of the tissue that's been removed. Yeah. And let me say one thing about that. So there's a study that came out some years ago about American medical school textbooks that are used for American doctors to study for their anatomy exams, and some 70 or 80% of these textbooks simply just didn't depict a foreskin anywhere in the drawings of the anatomy. So what you have is basically the male body depicted with a missing part on the genital. And so American doctors themselves don't have foreskins if they were born early enough when the rates were higher, and don't know anything about the tissue. So it's not surprising that there's this sort of general view that it's probably not worth anything. But that's just not the view in societies where circumcision is not common.
I think the same thing applies also to when people often bring up the preference of women, which is a really, really strange argument to make. It's like, women prefer circumcised penises. Well, the point is, are you going to do cosmetic surgery on a newborn? If they prefer to get yourself circumcised when you're 18, make that choice for yourself. But one of the clarifications for that is that only 35% of the men in the entire world are circumcised. The vast majority are not. So if you do the same polls and the same sort of surveys, and then they have been done for example, in Europe or in Southeast Asia or somewhere else, women will. Their responses will be according to what the trend is over there.
Those surveys are also very in the United States. So rates are like only 20% out of the hospital on the West Coast. They're higher than that on the East Coast. So even if you're in some portion of the U.S. and you move, let's say you're born in New York City where rates are pretty high, and then you move to Los Angeles where rates are pretty low. All of a sudden now the norm has changed, and what people prefer may well be different. The other thing about this is I do find it interesting when people say that I should make a decision about an elective surgery on my infant based on a speculation about what his future sexual partners might prefer. Among gay men, by the way, tend to prefer intact rather than circumcised genitals, according to the limited bit of research on this. So one thing is, if you don't know if your child's going to grow up to prefer sexual interactions with men or women, you don't know what those future partners are going to prefer. But the whole notion of it is something that I think would be seen as very peculiar, at least if we were talking about a little girl. So some women get labiaplasty when they grow up, and that's their choice. Often those decisions are shaped by troubling norms that have a narrow view of what should be considered beautiful. So it's not an unobjectionable thing that occurs. But given the fact that some women eventually go on to decide to have their labia partially removed, would never, ever constitute an argument for doing neonatal labiaplasty. The thought being, well, it's okay. Well, she won't remember it. It'll heal better at this age. And, her future sexual partners will probably prefer, shorter labia. So let's just get it out of the way now. I think people would rightly be up in arms about that, because it's her choice. If she wants to have that surgery done, that should be up to her. And I think the same thing is true of infant boys.
Right. One thing, actually, you said they won't remember it. This is actually relevant to the question that is in the live chat, but one of our patrons, which I would read, because a lot of people say they won't remember the pain. But the thing is that you're actually, even if they don't remember it, they are suffering during the time that this is happening. Fred, I'll read the question that Frederick is asking in the live chat, one of our patrons. He's saying, I remember reading that there is really no evidence that babies would feel less pain than older children or adults. Anything to this? Because the healing process after my surgery, Frederick's surgery, at 4 or 5 years was hell. So do babies are basically, when they're crying and screaming, they're going through the same amount of suffering than an adult would be, right? Is that correct?
Well, it's obviously hard to study infant pain because infants can't verbalize their pain. They can't say, I feel a 10 out of 10 on a scale. And so you have to make inferences based on other measures, cortisol levels spiking, the activity of nerves firing, and these sorts of things. And by any measure that you can take in this sort of nonverbal suite of measurements, it appears that infants experience, if anything, more pain than adults because their sort of pain system is not fully pruned down to the adult organization. And so you have this sort of pain just spreading out in a way that, as far as we can tell what an infant's experiencing, certainly it's very unpleasant for them. The other thing about remembering it is that there's no doubt that circumcision is extremely painful for infants. And some people say, well, you can use pain control. That's true, but you can't use general anesthesia, which any adult would demand. I mean, if I were going to get a genital surgery, I would say I want general anesthesia. I don't want like a local lidocaine type thing that you just put on the area. Right, but infants can't tolerate general anesthesia, and so because it's too risky. And so what you do is you have to use essentially a less effective form of anesthesia. And the infant can't say, please give me more. Adults, if they're going through a surgery, it's certainly not pleasant for the adult either, but they can say, I want more pain control. Here are my needs. Here's how you can respond to them. The infant is just completely lacking in any agency in this setting. So insofar as there is this extreme pain, there's nothing they can do about it. Another thing is early exposure to noxious for infants has neurodevelopmental implications that are just now beginning to be researched. This is very interesting because the American Academy of Pediatrics Committee on Pain and Anesthetics came out in 2016 with a policy saying that there's now quite a bit of evidence that early exposure to pain in infants can affect essentially the way that their pain system wires up, such that later on they have different thresholds for their tolerance for pain as a function of even one-shot interventions. In fact, in one study, what was studied was circumcision. It turned out that 6 months later, the pain threshold had changed. So even though you don't have formed conscious memories, it's very likely that the risk of neurodevelopmental problems may be raised, and in ways that are very hard to study. So we don't actually know entirely what the effects are of early pain.
Follow-up question is, but even if they didn't remember it, and even if there was no health risk at all to this, shouldn't this be completely banned given the fact that at the time you're torturing a fully conscious being and they're feeling a lot of pain? Like, shouldn't just, even if they don't come, I mean, we're basically torturing a little baby. Isn't that what we're doing?
For no reason, too. I mean, these are completely healthy newborns. And I want to draw an analogy to, again, tonsillitis, for instance. If a child has tonsillitis, you have to have a repeated number of episodes within a certain amount of time in order to justify surgery to take out the tonsils. And the tonsils are really, they're not even as useful as a foreskin is. But neonatal circumcision or infant circumcision is the only surgical procedure that is routinely practiced on completely healthy newborns without any surgical indication, or what surgical indication means, surgical justification. So that's it is completely unique in that regard.
Yeah, I mean, so part of what my research is in medical ethics, and it's just standard that you don't perform surgery on healthy children. Just that's kind of a bright line rule, unless you have very, very good reason to intervene because it's the most conservative and effective and necessary way to treat an extant disease, or if you have a case of repeated infections of a part of the body or something like that, then you might remove that part of the body. But if you just have healthy tissue, there's literally no other case It's a part of common medical practice to just remove the tissue for essentially cultural reasons. On the matter of sort of torture, okay, without anesthetic, that's certainly the case. I mean, just imagine if you had a surgery on your genitals as an adult without anesthetic, it would be certainly consistent with definitions of torture. I mean, it would be excruciating pain. And it is certainly excruciating for infants. For the longest time, infants were not given anesthesia. Up until about the 1990s, there were still, among older doctors, this view that babies don't feel pain. There's a whole conversation we could have about how this myth had taken hold in the medical consciousness. But for the longest time, babies weren't given any pain control, and they said, well, babies cry at everything, so, they're just going to fuss about this. It's really just a major failure of empathy. Because babies can't use words to say stop, it's very easy to discount their experience. Now some doctors do use pain control, and it's not clear what percentage, and it's certainly not 100%. It's probably closer to 60% or something around there. It depends on the region and how old the doctor is and what practices they're used to. But let's say you're using the very best form of pain control you can use short of general anesthesia, because that's contraindicated. There's something called dorsal penile nerve block or ring block. And this is, you have to essentially inject a needle several times into the base of the penis to administer this nerve numbing substance. And then you have to wait for it to set in, and then you perform the surgery. And there's been some studies on this where they have measures to determine what they consider clinically significant pain for the infant. So like, how much did they grimace? How much did they scream? What are the physical indicators that the infant is experiencing quite a lot of pain?
This sounds horrific, just hearing you talk about it. How much did they grimace?
Yeah, they've got a whole bunch of studies where they study infant pain by essentially having them go through a surgery that's not necessary, and recording scores about how much pain they're in if they use this kind of pain control or that kind of pain control. But the finding from one study on this is that about 75% of infants experience what they call clinically significant pain just being administered the anesthesia, because when you have a needle jammed in the base of your penis, it's very, very uncomfortable. And so if you're concerned about clinically significant pain, the best thing to do is just not do a surgery. That's the least painful option. If you're going to use pain control, you have to use this nerve block, which is extremely painful to administer. And then it still has a 7% failure rate. So what they found was that above 7% of these infants still had clinically significant pain actually undergoing the surgery, supposedly having had their nerves numbed. And anybody who's been to the dentist and got a tooth pulled or anything like that, you know that sometimes they don't quite hit the nerve right, and all of a sudden it starts to really hurt a lot. And what happens is, if you're an adult, say, hey, please stop, that hurts. If you're an infant, that's just it. You keep going on with the surgery, and there's nothing you can do about it, and the doctor isn't going to notice.
Mm-hmm. Yeah, I wanted to move on to because the main controversy around this is about the health benefits. That's what everybody talks about. So I wanted to actually move on to that. But before we go there, there are a couple of other sort of questions that people bring up, and I wanted to make sure we cover them. So two questions. The first one is, I guess, going off Armin's point about comparable procedures. One thing people bring up is vaccination. The other one they bring up is ear piercing.
Yeah.
And the second question I wanted to ask, as a sort of segue to talking about health benefits, is that are there any studies? What's the latest when it comes to studies of adults who were uncircumcised and became circumcised, and what were the effects of that? Was there any loss of sort of sensation? Any
Is this reason on faith's question? I just want
No, this isn't. We're going to get to that right after. Okay. Because that's about health benefits, so I want to talk about that later.
Okay.
Sure. So, some people raise an analogy to vaccination. They say, well, parents can authorize that, which is done in the absence of disease. I mean, it's preventative. It happens before you have a problem. Then why can't they authorize a circumcision? Similarly, they say, if you can pierce a girl's ears, which, by the way, not so sure is a good idea. It's very painful for young girls to have their ears pierced. Well, so you might as well just leave them alone. But okay, if you think it's okay to pierce ears, it doesn't follow from that circumcision is a comparable procedure. So just a couple of disanalogies between those two to start. When a male child is born, the foreskin is fused to the head of the penis by a membrane, a little bit like how your fingernail is fused to the bed of your finger. And so in order to separate this tissue, which naturally later on in life, this will just separate on its own, but you have to forcibly separate the foreskin from the head of the penis with a probe. And this leaves the glands very bloody and red, and you create a wound that then is in a diaper for some weeks during the healing process, and you have to keep applying petroleum jelly, and you have urine and feces around an open wound. What the foreskin is there for is, by the way, is to protect the penis and to keep out contaminants from the urethral opening. And so you have to first do this excruciating thing, and then what you're doing is you're removing a lot of erogenous tissue. Now, compare this to ear piercing. What you do is you create a hole in the earlobe, and there are some risks. You might get an infection, but the hole will often close up over time if the girl decides she doesn't want it, or the boy in that case. And you're not removing tissue from the body, and certainly not psychosexually significant tissue. The sort of scale of the intervention is just wildly different. Similarly with vaccinations, vaccinations don't remove tissue. They involve a pinprick to the arm or wherever the injection is taking place. And again, it's painful for a moment. Then the pain subsides and there's nothing left. There's no change to the body. There's no sort of morphological alteration where the child says, gee, I really would like to have that part of my body back. That just doesn't arise in the case of vaccination. So I think people need to have a more fine-grained analysis. First of all, just know what they're talking about. Circumcision is a surgery. I think why people even think it's comparable to vaccination is because they just literally don't know what a circumcision is. I mean, you can go on YouTube and just watch one if you want.
Or often what they don't know what vaccination is either nowadays.
Yeah. So that's what I say about that. If you watch one circumcision, you will never ever consider comparing it to vaccination or ear piercing. It's really a ridiculous comparison, but it's a common one.
The second part of the question was just about,
right.
Well, it wasn't the second part of this question, it was a separate question altogether. But any studies on adults who were uncircumcised and then became circumcised and the consequences?
Yeah, so there are a couple of studies on this, and they're very interesting to talk about. So the first thing to realize when you're talking about adult circumcision is that these adults are not randomly sampled from the population. These are people who, for whatever reason, are seeking out a circumcision, whether because it's for a cultural reason or because they have a specific problem, one of the rare problems that can sometimes befall a foreskin, and circumcision is what they consider to be, in consultation with their doctor, the appropriate treatment. If somebody is dissatisfied with their penis in its current state, and then they seek out a surgery that changes that aspect of their penis, it shouldn't be surprising that they would feel improvement along some dimensions. This is different from if you took a random person from the population who is very happy with his foreskin and said, we're going to assign you to the circumcision arm of this trial and see how you feel about that. That very same person might be profoundly resentful.
Yeah.
And so one thing you have to realize is that
sorry to interrupt. I was saying that's kind of where I was going, because I know if somebody has phimosis, which is a foreskin that's too tight, or any kind of medical condition that is painful, then obviously the circumcision will be a relief. But I guess a more specific example would be somebody converts to Islam, or somebody converts to Judaism for marriage reasons or for whatever reasons, and then they have a circumcision. So in a case like that where they're otherwise healthy.
Yeah. So there is a study from South Korea, where circumcisions were picked up from the American military in the 1950s. It didn't used to be done there. And during the occupation, it became a cultural habit in Korea. The difference, though, is that they do it later in life. They don't do it in infancy because they consider infants too fragile and too vulnerable to undergo a surgery in the first days of life. And so you do have some sort of before and after cases where the male is old enough, sometimes 18 or older, and they have had some sexual experience before having the surgery. They have it removed without having a medical problem, and then they have after experience. And this is by Kim and Pang. And I don't have the exact percentages memorized, but what they found was that something like 60% of those men experienced decreased sexual sensation, pleasure, overall satisfaction. 20% experienced improvement. They have these figures for sort of masturbatory pleasure, different kinds of things. And what they found was that in the case where you have a legitimate before and after measurement, the majority of the cases experienced loss of sensation, loss of enjoyment, and so forth. There is also some research that was done, and this will tie into the health benefits thing, with these trials in Africa, seeing whether circumcision will reduce the risk of HIV. And they threw in some questionnaires at the end of those trials to say, basically, how's your sex life? And what's fascinating about this is a sort of sociology of science thing that I think is very, very interesting. These questionnaires were essentially useless. They were not validated questionnaires. And what they found was that essentially 99% of the participants in these circumcision trials reported wonderful sexual experiences, which means that they had a ceiling. The scale isn't sensitive enough to detect any differences between the, control arm and the intervention arm. They also had just a short-term follow-up. The thing about infant circumcision is that you remove this protective covering from the head of the penis, and then you have like 10 years or 12 years or 13 years before, with this glands rubbing against clothing and undergoing other sorts of changes before a person would even possibly have a sexual experience. And so this person doesn't have an alternative in their mind because they were circumcised when they were an infant. And so they have no point of comparison that they can use to answer whether it would have been better otherwise. Mm-hmm. Whereas in the adult case, they do these trials and then a few months later, they give you a questionnaire. You have to do long-term follow-up here. The effects of removing a tissue from the penis, and then 24 months later is the longest you wait to ask people whether it's had any adverse effect. When do problems with sexual function start to pick up is a little bit later in life. That's where you're going to get the variability and the exacerbation of problems. And yet there are no data on this. And so what happens is these poor quality questionnaires, which are not validated, which were not sensitive to even pick up differences that did exist. They're really literally like Likert scales, like you use in psychology, like 4-point Likert scales. Is your sexual experience 1, really bad, 2, okay, 3, pretty good? This is not a fine-grained way of assessing the complexity of human sexual experience. But because they didn't find a difference in the two groups, this is now considered very high-quality data because it was from a randomized control trial. And so this now gets in all these meta-analyses, particularly there are a couple of researchers who spend their entire careers just pumping nonsense studies into the literature to try to make it look like circumcision is the best thing ever. And one of these researchers, whom I won't name, has written a systematic review drawing great attention to these African trials, saying the highest quality data shows that circumcision has no adverse effect on sexuality. And then this gets cited in the CDC report and the American Academy of Pediatrics. They say, well, the highest quality data. This is why you have to actually read scientific papers carefully. Simply having a questionnaire in a randomized control trial doesn't mean it's good quality data. The data is only as good quality as the questionnaire is. Simply being embedded in a relatively strong study design doesn't mean that you're going to get any meaningful information from this. And the other thing is these are adult circumcisions. This is not infant circumcisions. And so you can't extrapolate from one to the other. And yet all of this just gets sort of swept aside in favor of these policies that come out that are not nuanced.
Right. I think this is the main thing. Now, going to the health benefits, and especially all the Africa studies that showed a link between, circumcision and decreased HIV, a decreased chance of contracting HIV. The important thing to remember that is these studies were all done in adults. These studies were all done in grown people who voluntarily chose to be circumcised. And, one of the basics of medical ethics, if you look at, clinical trials on medication, surgical procedures, is you can't extrapolate that and you can't apply that to infants. So that is, I think, right at the headline, that's a problem. And another thing I wanted to kind of, for our audience to know, you mentioned the sensitivity of the glands, how it's rubbing against clothing and so on. So one thing that happens, and this is something, obviously we knew as pathologists, is that uncircumcised penises, the head of the penis, which is the glands, is sort of, it has a mucosal surface. Mucosal means it's sort of like the inside of your mouth. It's not covered with skin. But when it's exposed to the air, it becomes what they call keratinized, which means that it gets covered with skin. So that automatically, you can imagine how sensitive the inside of your mouth is, the mucosa there versus the skin. And you can imagine the kind of loss of sensation that there is there. So moving on to the health benefits, and this is kind of what we want to talk about, including these studies. So I'm going to read a question from someone called Reason on Faith here.
Which is one of our patrons. Thank you so much for your support.
Yeah, thank you. And these questions are from our patrons. So he says, proponents of circumcision will often point to studies in respected journals, RE health benefits. So what's the latest on the scientific front? In what way are these studies flawed or valid in your estimation?
Okay, so I'll talk about the HIV studies because these are the ones that got the most attention, and these are the ones that have prompted a sort of recent renaissance in discussions of whether there may be health benefits for male circumcision. So the first thing is, you'll hear that there's a 60% reduction in HIV. People just say, male circumcision, 60% reduction in HIV. What could be better than that? And they don't add any of the qualifications that are necessary to understand what that statistic means. So the first thing is that statistic is derived from studies of adults undergoing voluntary circumcision in sub-Saharan Africa with very high base rates of HIV, which is not the situation in most Western developed countries where your absolute chance of getting HIV is incredibly low, and it's mostly among men who have sex with men and injecting drug users, for which there is zero evidence anywhere of a protective effect of circumcision. The second thing is these data were derived, you'll always hear these 3 trials that were carried out in Uganda, South Africa, and what was the other one? I've lost it off the top of my head, where they say this 60% reduction has occurred. What nobody mentions is the 4th trial. There were 4 trials conducted. The 4th trial looked at transmission from males to females. So the 60% reduction is from female partners to males only. The trial that was looking at male transmission to females had to be stopped early due to something called futility, which means that the female partners of circumcised men were getting infected with HIV at a higher rate. So it was the opposite of the intended effect. And so they had to simply stop the trial early. And now this never gets cited anywhere. You never hear about it. You only hear about the 3 trials that were very successful and give you the 60% figure.
Yeah, I always find that amazing that they actually stop the trial. I know that they do that because of futility, but they were actually, the trajectory was towards finding the opposite of what they went to look for, but they just stopped it. Which is
exactly.
Interesting.
The other thing is 60% is what's called a relative risk reduction. So it's one baseline compared to another, and you see each other, and the output is the 60%. What you really want to know about is the absolute risk reduction. So this is sort of like the absolute level of protection offered by this procedure in a given epidemiological environment. And the absolute risk reduction in these trials was 1.3%. Now, that across many cases and lots of possible infections, that may be important, but it's far less impressive sounding than 60%. On that note, I'll say another relative risk reduction example so that you can just intuitively see why this matters. Another health benefit that's often raised for circumcision, and pretty much the only one that's relevant to newborn circumcision, is that it's supposed to reduce the risk of urinary tract infections. And what people will say is it's this massive reduction of risk if you are a circumcised boy compared to a non-circumcised boy. What you don't realize when you hear that figure is that if you're not circumcised, you have a little over 1% chance of getting a urinary tract infection in the first years of life if you're a boy. And if you are circumcised, it's slightly under 1%. And if you divide slightly over 1% against slightly under 1%, you get this big number. And that's what looks very impressive. But the absolute risk reduction is tiny. And so you'd have to perform over 100 circumcisions to prevent one urinary tract infection. And what do you do in the case of girls who get urinary tract infections? You treat them. You don't perform preventative surgery. You don't remove folds of tissue where, bacteria might get trapped or something like that. And so, again, this is just sort of grasping at straws to try to build a secularly defensible case for a surgery.
Yeah, and this is one thing that is a little bit frustrating sometimes to explain to people. If you have a UTI, urinary tract infection, you can cure them. You can treat them with antibiotics. There is a treatment for it. One of our surgery attendings used to tell us the number one rule of surgery is avoid surgery as much as you can. So, if there is a medical or conservative way to treat something, right? That's what you use. So you can treat UTIs with antibiotics. You can treat hygiene issues with washing. That's all you got to do. 70% of the world's population does it, right? So
yeah, the rate of urinary tract infections is actually far higher for girls. So it's about 10 times more likely that a girl after the first year of life will get a urinary tract infection compared to a boy. And there, you as you say, you treat it with antibiotics. The other issue, Gene, girls wash their genitals. There are certainly folds of tissue where you can get, microparticles trapped or whatever, but nobody says, well, let's just remove the folds of tissue. It's sort of like, wash behind your ears or chop your ears off. Removing tissue as a form of hygiene is something that in any other case would be seen as laughable. And yet here it's trotted out as sort of a reasonable suggestion.
Mm-hmm. So yeah, we have about 10 minutes left, and Armin wanted to ask a couple.
Okay. So Kim, moving a little bit to a different side of this, how did this even, as the source of this, only religious? Because I can't imagine how do we as humans decided that it's okay for us to chop a part of a human body at such a young age. I mean, if this was not the norm, and if it was being introduced today, I think people would be freaked out to even hear about it. Like, imagine if there was a new cult and they were just chopping off the little finger of little babies at the beginning, before they even got a chance to decide if they want to be part of a cult or not. But and if is the source only religion? And if how has it become such a, even among the non-religious people, this has become the norm? How did it manage to, if the source is religion, how did it manage to impact such a wide range of people that are not even religious?
Yeah, that's a really good question. So, genital cutting predates Islam and Judaism. It was an ancient African practice, probably done as a rite of passage into adulthood, which is still how male and female genital cutting are predominantly done in many different African countries. So, what people don't realize is that they refer to as FGM, female genital cutting, is in any society that performs female genital cutting, they also perform male genital cutting. And often it's in parallel as a rite of passage into adulthood, where both the boys and the girls are initiated by being circumcised into adulthood. And the thing there is that the girls are expected to be just as courageous as the boys, rather than having the sense that, oh, they're fragile and need to be protected. The thought is that they're just as tough as the boys, and they go through this painful procedure to show that they deserve to be adults in the society. So the ancient history of circumcision is as a sort of non-religious ritual in the sense we think of religion today. And it was picked up by various Semitic groups and eventually got folded into Judaism and picked up by Islam and sort of given this religious connotation, which is how circumcision was sort of introduced into Western consciousness and became a familiar practice. The way it got picked up by secular folks is very interesting. In the United States, the story is very well known. In the late 1800s in New England, circumcision was introduced as a method of combating childhood masturbation. This was at the same time that carbolic acid was being applied to the clitorises of girls to stop them from masturbating, and the male version of that was to cut off the foreskin.
Can I reveal who proposed that?
Yeah, if you want.
Because that'll be a fun thing for the audience to know. It was John Kellogg, the cornflakes guy. He's the reason that circumcision became such a huge deal in the United States around the 1800s was because he suggested we circumcise boys to prevent masturbation, and we apply carbolic acid or phenol to the clitoris of little girls to prevent masturbation. So not a great guy.
Kellogg was invented cornflakes, by the way, to be easily digestible. The thought was that it was supposed to be a very bland cereal because the sort of religious sect that he was this sort of Puritan group was very opposed to any kind of stimulation whatsoever. And so cornflakes are very bland for that reason. Circumcision was promoted by Kellogg for that reason. He wasn't the only one. There was a very ambitious orthopedic surgeon named Louis Serra who was also kind of shopping around as a cure-all at the time. And the thing is that
were they both religiously motivated?
No, well, in the case of Kellogg, there was a happy alliance between the religious prohibition on masturbation, which suggests it's sinful, and then this developing medical notion, which suggests that it's good not just for your moral hygiene, but for your physical hygiene, because masturbation was thought to be the cause of medical problems. So I'll just explain this for a second, because when this secularization of circumcision took place, it was because medical theory at the time was very underdeveloped. In fact, they had the wrong theory of disease. It was something called the nerve force theory of disease. And the general idea was that nervous excitation caused blindness and epilepsy and hip problems and hairy palms and all sorts of other problems was due to the stimulation of nervous tissue, which is the sort of thing you would do if you were stimulating your foreskin or masturbating generally. And so they thought by removing tissue the child would be tempted to touch because it would be pleasurable, they could prevent all these sorts of medical ills. And so the sort of crossover from a religious practice in early New England, where it was also a Jewish practice. And by the way, Jews had rates of venereal disease at the time, and this was thought to be, it must be because of circumcision rather than because of cultural norms governing the way sexual behavior is carried out. And so this is another issue. People tend to want to point to human anatomy as the cause of problems when it comes to, say, sexually transmitted infections, and they completely ignore the sort of social and behavioral factors that are like a million times more predictive of whether you're going to face a problem in this regard, because, you know, it's so much easier to say, well, just go through a surgery, and then you actually ignore the more important predictors of sexual health. So this is what was going on at the time, and if you follow this out, you see that it gets picked up as a cultural norm essentially, and it gets embedded such that a lot of doctors themselves were circumcised, and so it just became part of the medical culture in the United States and got passed on generation to generation.
Just before, I don't know if you want to stop at
I can stay a little bit longer actually, so we can carry on the conversation. Yeah, that's totally fine. So go ahead and I'll raise a hand or something when it starts to get tight.
One thing that frustrates a lot of people that are not as haven't looked at as many researchers as you two have is that, you know, they can't tell what research is good. When you see a research, how can they tell? Like, should they just be trusting you guys to tell them that this is a good research, that's a bad research? Like, they don't know. They can't tell when they see a research, they think, well, the whole bunch of scientists published the research, so who am I to say that this is not a good research? And you're telling them that this is bad research. They're saying, no, this is good research. What should they base it on? Yeah.
So this is a fair question, and actually, my whole other area of research is on essentially the trustworthiness of science. There's something people may have heard of called a replication crisis that's going through certain areas of psychology, but also biomedicine, where people are having people are having a hard time basically reproducing the results of studies that were published in leading journals. And in the case of psychology, it was like only 30% of results could actually be reproduced when people tried to rerun an experiment that had been published in a leading journal. So the thing I want to say about this is, it is actually really hard to know what's reliable, and it is particularly difficult in the case of a contentious or polarized area in the literature where people who have very strong ideological backgrounds who want to sort of prove a point one way or the other are, as I say, pumping studies into the literature to support their view. So essentially, there is no way to know how to evaluate a study other than to become an expert in the area, which is not obviously the sort of thing a person off the street can do. So what I can do here is just do an appeal to majority, which is that if you ask the majority of medical authorities in the world whether male circumcision is on balance a medically beneficial procedure, the majority position, in fact, the virtually unanimous position, is that the health benefits do not outweigh the risks, costs, and harms. The one exception to this was the American Academy of Pediatrics in 2012. Their policy has now expired. And when they met with criticism from heads and representatives of pediatric bodies throughout Europe, also a major pediatrician from Canada, pediatrician in England, who said, these are very senior physicians, who said this document is just scientifically not very respectable.
There's also like a precedent back in 1932, there was a study by a guy called Abraham Wolbarts, and he talked about penile cancer, how circumcision eradicates the risk of penile cancer. And they later, obviously, this research was discredited because he also happened to believe that circumcision prevented masturbation, also epilepsy and infant death. So I guess that's also another way you can kind of sort of, if you do a little bit of research, you can kind of look at what kind of agendas motivate people. And there are a lot of religious cultural agendas that motivate physicians and researchers as well.
Well, I want to say something about that, because it sounds like a motivation could be raised, and what's the evidence for this? There is some evidence that the American Academy of Pediatrics had a sort of extra scientific political goals in mind. So one of the task force members, a doctor named Andrew Friedman, wrote in after the fact, after there was all this pushback from the European physicians saying, what are you talking about? The benefits don't outweigh the risks. And he said, the fact that circumcision was attracting censure throughout Europe, with some countries proposing to ban it, he said, was not an idle concern in our mind as the pediatric committee when we were writing up our policy. He was saying we were aware of the fact that circumcision is contentious, We wanted to write in our ethics section at the end that for religious reasons, parents should be able to circumcise their children if that's what they see fit. And they realized that it would be pretty helpful if they could support that with some medical claims. The problem is that nobody took the bait. The European physicians who have access to the very same data reviewed it and said that's just simply not what follows. It is not the case that the benefits outweigh the risks of this procedure.
You do mention that you don't want to call out other people, but shouldn't they be called out and shouldn't be like identified as? I mean, if we're talking about causing so much pain to little infants and basically torturing little children, and people are trying to find ways because of whatever bias they have to come up with excuses, isn't this like? It sounds like evil. Like, shouldn't these people be called out and shamed for what they're doing? They're basically excusing torture of little babies.
In general, I don't find that very helpful because nobody who promotes circumcision wants to harm a child. There really isn't anybody with evil intentions in mind trying to hurt kids. Any parent who authorizes a male, female, or intersex surgery is doing it because they think it's in the child's best interest. They say, well, it'll hurt him a little bit now, but it'll be better for him later. I think they're mistaken. And I think a lot of doctors, even in the United States, again, these doctors themselves are circumcised, typically. They don't know anything about the tissue that's removed. And they're very used to, because of the cultural norm, authorizing that it should be removed. And so I think it's these social and structural pressures that are normalizing a practice that, you're right, if it didn't exist, if circumcision wasn't around today, and somebody proposed, hey, we've got this new thing we're going to do. We're going to cut off the end of boys' penises. They would instantly be arrested. I mean, there's no doubt that it would be considered obviously illegal.
Parents that don't know better, or people that might not know that this is the truth, but you also mentioned scientists that know that this is not scientific, but they have other biases and they're pushing for this. Yeah.
It's really hard to say. I think, scientists can dupe themselves as much as any other person can. The measures that are in place in scientific practice to try to protect against biases, like peer review and these sorts of things, they're good faith attempts to try to allow people to check their biases when they're performing studies. But when you look into the research on biases that scientists have, you find that often they really believe what they're saying and they're just not aware of the biases. And you can find this, for example, they've done some wonderful studies on this where they'll take a paper that is identical across two cases, but in one case it supports the sort of prior beliefs of the doctor, and in the other case it's opposed to it. And they can run these studies on doctors and scientists and just ask them to evaluate the paper. And it's not surprising. You find that when the findings come out in favor of what the prior position is of the doctor, they say, this is a great paper, this should be published. And when it opposes what the doctor thinks, all of a sudden they think, well, I maybe better look at the methods section here and see if I can find any problems with the paper. So scientists are people too. Scientists have the same cognitive biases as everybody else. Ideally, they try to mitigate these biases, but I don't think there are scientists. I mean, maybe there's some exceptions to this, but and certainly it's hard to get inside anyone's head. But I think it's unlikely that people think that they're really trying to dupe other people into doing a surgery that they know is harmful to children. I think they really believe it's not harmful. I just think that they're badly mistaken.
So sorry, go ahead.
No, you go. If you have a question, go ahead and ask it. I have another question as well.
Yeah, no, I was going to ask you it's actually a really quick question from one of our audience members. His name is Jim King, and he says, well, when you talk about the ritual nick FGM version, does the clitoris heal okay, and is it fully functional as an adult?
Okay, so there's competing reports about this. One case that is in process right now in the United States is concerning a group called the Dawoodi Bohra, which is a small Muslim sect that has members in Detroit, Michigan, and elsewhere. But the case came up in Detroit because this doctor, this physician, a member of this group, was performing these ritual nicks on the girls. What's very interesting about the Dawoodi Bohra is that they perform circumcision, as they call it. They use the word khatna. It's the same word for both boys and girls, on their daughters as well as their sons. So for them, it's an egalitarian right. And the version that they do to their daughters is far less invasive than what they do to their sons. They do a prick to the foreskin of the clitoris. They don't typically remove tissue. Although, again, it's very hard to know, right? Like, who's standing in there taking on this? The doctor knows it's a prohibited procedure and was doing it sort of under the radar. And so you just have to sort of ask people about their experiences. And again, a lot of these girls grow up, some of them very angry about what happened. So a lot of them will sort of start doing research online and find out, wait a minute, what's this thing called FGM? Oh, wait, I think that's something that happened to me. I remember this thing when I was 7 and somebody was holding me down and I was in the doctor's office and they took a sharp object to my vulva and it was really embarrassing. And yeah, now that I think about it, I've noticed these sort of weird nerve feelings and these sorts of things. So some of them are extremely angry about this and have been leading a campaign to raise awareness about female genital cutting among the Bora. But honestly, the majority of women in the Bora say, no, this is our culture. This is our practice. I'm not harmed. It's better this way. This is only right and proper that this be done. And so you find these divergent attitudes, and it's really hard to get past people's psychologies to get to the, objective truth about what exactly happened. The sexual experience is not primarily about how many nerve endings do you have in your genitals. It's about how do you feel about your body. And so what you find is a lot of people are just kind of floating along in ignorance about their bodily state. And then they get on the internet and they go, wait a minute, something was taken from me. Or wait a minute, somebody took a knife to my genitals. And that makes me really upset. And then these psychological dimensions now contribute negatively to their sexual experience above and beyond any effects of the nerve damage. So the other thing to say again is just if you're bringing a knife to a child's genitals, the chance of something going wrong is not trivially small because you have a very small target. And if you mess up just a little bit, you could very well cause serious problems.
Right.
So, Armin, you want to ask one more question, then we can let Brian go. But I want to know, do you want to stay on after Brian leaves and maybe?
Yeah, I would like to stay on.
Let's do that.
So, do you have any theories for why this was picked up? I know like religious stuff doesn't make any sense often. I mean, if not always, but usually when a culture or religion picks up something and it seems ridiculous, it's usually some people suggest that it must have at some point helped the survival of the meme that is the culture or the religion. Even if it is harmful to the individuals that are carrying the meme, it is beneficial to the survival of the meme itself. Do you have any theories? Some people suggest that this is kind of like was a test of loyalty because it was so extreme to show that you belong to this tribe and you would do anything to stay in the tribe, and that was how it. Yeah. But I don't know if that's
including mutilating your firstborn, like that kind of thing.
Yeah.
Would you do that for the rabbinic authority or whatever?
I mean, the Jewish story is that God had a covenant, and he was like, he made a deal with the Jews. You give me foreskin. I don't know why he was so obsessed with foreskins, but he wanted foreskins in return for making their children. Anyways, but that was the story. But I don't know.
I just want to say a quick thing about that. So this is the biblical story. You're giving the kind of literal account, and most American Jews are atheists and probably don't take the story literally. But nevertheless, the idea is that Abraham, in response to God's blessings, agreed to sacrifice his foreskin, and he was circumcised at the age of 99, as the story goes. And to be honest, I sort of understand the logic of this. If it really is a sacrifice where God has given you all this great stuff to you and your progeny, and you say, I'm willing to give up something of value to me. I'm going to, cut off this part of my penis as a sacrifice to the Lord. That sounds like something that I can sort of at least understand as a secular person. What I don't understand is doing it to an infant who doesn't know what's going on. The infant isn't saying, yes, I'm so grateful for these good things, and so please take part of my penis as my offering to you. Instead, you're performing something on a person who cannot say no and who has no idea about your metaphysical beliefs and may very well reject them. And so I have some Jewish friends who are very angry about having had the most private part of their body, in their view, permanently branded or marked with the sign of their parents' religious commitments that they then grow up not to share. And this is disturbing to them on a day-to-day basis. They say, listen, I don't believe that this sacrifice is sort of imbued with all these religious and cultural values that maybe it was to you. And yet you made this decision for me before I could even talk. much less understand the religious system into which I was being raised. And, this is very interesting because part of why in Judaism it's done so early, one theory is that it used to be a rite of passage as it remains in most communities around the world that's done around puberty. But if you wait till puberty, some people might not want to do it. And so if you do it to an infant, you remove that problem where the person doesn't have the option of not conforming to the norm. Because
there'd be a reason they wouldn't want to do it later on in puberty. So. Yeah, that actually supports the thing against it. But Brian, thank you so much. I know we're kind of like 8 minutes over, and you have to go. So I really, really appreciate you coming on. And this has been just hugely educational, and you're just a treasure trove of information.
By the way, people in the live chat, don't go away. I mean, Ali and I will stay on. We just promised to have we went over 1 hour. We just wanted to make sure we don't go too much.
Right, and we won't say anything bad about you, Brian. It'll all be good after you're gone.
But if there's remaining questions, we can do a part 2 at some point, or people can obviously email me if they want to follow up on anything.
Oh yeah, actually, before you go, how can people reach you?
Yeah, so first of all, my papers on these topics are all available for free at academia.edu is one way. You should just Google my name, which is Brian Earp, my last name, and you'll be able to read these papers and sort of see the citations for yourself and check everything out if you want. And my email is available also on that page. So you can send me a note and see if you have any questions, and I'll be happy to follow up with anybody.
If you send us the links, we'll put it in the description once the podcast and the YouTube version of this is available.
And I already have them. I have a list of them, so I'll provide them, and I have a list of all the papers that you sent me.
Social media stuff, no?
Yeah, I'm on Twitter at Brian David. You can find me there. Yeah.
Yeah, and you've got a great feed actually. I really like it. So if you want
likewise.
if you want to learn more about this topic and about all of the other topics that Brian is interested in, really, it's Brian David Earp on Twitter. So definitely follow him, and you do engage quite a bit too with people who who provide counter arguments, and you do it in a really sort of a really good way. It's not all outrage and anger all the time. So it's really, you're very cool and collected when you respond to people. So I really like that, and I appreciate it.
Yeah. Well, thanks. Thanks for the very good conversation. And obviously, there's so many complicated angles here that we could go on and on about. So thanks for getting into it as far as we could get. And I hope to talk to you guys again later.
Yeah,
me too, for sure. It was good to finally talk to you face to face, because I know we've been interacting for several years now.
Exactly,
on and off. So
it's like you're a real person. There you go.
There you go.
By the way, guys, if you're a podcaster or if a YouTube channel, consider inviting him on your channel, because it seems like
and this is a hot topic right now. So not only do you have the Iceland issue, you also have recently, one of our good friends and previous podcast guest, Maajid Nawaz, who's a very, very high profile, public Muslim figure, has come out against circumcision as well. He has a child, and he did not choose to circumcise him. And then he's been getting a lot of heat from the Muslim community for it. So he's brought the debate into the spotlight as well. So I think that we're going to be discussing this a lot more in the future.
Yeah, a lot of people are taking it more seriously. I just recently went to going from thinking this is not as big of a deal as FGM, it's not that important, to all of a sudden thinking, okay, it is a big deal. And now I'm actually horrified about it. So I think it's good that more people are talking about it, because it is basically torture of little babies. Anyways, but thank you so much. We're not going to keep you much longer, but thank you, Brian.
Yeah, great meeting you.
Take care, Brian. Bye.
All right, that was amazing, wasn't it?
Yeah, that's really, really, and I was telling you, I think Brian is just he's just amazing when it comes to this, and he's a very, very accomplished academic as well. I mean, as you can see, that's the reason I wanted to read out the intro, so that everybody knows that there's no real agenda. I mean, he's a very, very objective that kind of guy, and
and he's like he the way he talks, it seems like, I don't know, people can't. It doesn't. I mean, he doesn't talk like me. Like I'm very. It seems like I'm biased about things. There's a lot of passion when he talks. You could tell that this guy is.
You need both, though. You need both. You need the academic point of view, and he is a bit of an academic activist. He doesn't come across as an activist, so maybe I shouldn't say that. But I think that you do need activists in this dialogue, and you also need people.
Different people relate to different ways of people. But it does sound like this. He had done his homework. But the problem is that just because what I have a problem when it comes to scientific things is when people in the scientific community talk about things, it usually sounds like they know their shit. But then somebody else comes and talks about the same topic, and they sound like they know their shit too, and they're saying something that is contradictory to what you just heard. And you're like, well, I'm not a fucking scientist. How am I supposed to fucking trust, right? Like, I can't go analyze this myself because else I have to drop everything.
That's why,
go get a degree in all this shit, right?
Yeah, no, that's why science communicators are very important. I think
but science communicators is also, the thing is that science communication is about the way you communicate it. But then are you judging it now because you can't judge it based on the science, now you're judging it based on how passionately and how beautifully the science communicator is communicating it? Well, that's not a really good way of judging science, is it? Right?
Yeah. I think one of the trends, especially with this topic, and I think this varies for different topics, is that with this topic, the more education there is about this, the more people actually look at the evidence and look at the studies and see the flaws of the other studies that were done in the past, like from they say that male circumcision has always been a cure looking for a disease. So before it's like, we have to do it because it cures.
That's so good. Wait, yeah, that's a good. Okay, a cure looking for a disease. They wanted to keep it. They couldn't find it
right from the beginning. The 1800s, John Kellogg was like, it cures epilepsy, it cures masturbation. Later on, it cures penile cancer. Then it's kind of like
the pig eating in the not eating pigs in Islam. They kept on saying like look, we discovered pigs are. The problem is that every other meat kept on showing more to be more problematic than pig's meat.
That's a good analogy, because you know what? I've heard people say that pigs are filthy animals and they eat their own shit, so we shouldn't eat them. And then on the other hand, I've heard people say, well, when you want a valve replacement, you get it from a pig. Pigs are very close to humans in terms of their how advanced they are. So that's why we shouldn't eat pigs, because it's like that one step below cannibalism. So
they had to come up. So you already have a practice. You have to come up with why you're doing it after you have the practice.
Right.
But what do you think about this whole meme thing? The meme survival thing. Do you think that, I know it's been done to babies, but the fact that you physically have a mark on you that separates you from the rest. Right now, it's most people do this, right? In the world, like, it's much wider. But when it was just the Jews, when it was just a fraction of the population, right? Do you think that having that mark on your body, having that badge, as Jim pointed out in the live stream, that makes it make you feel more that you're part of the tribe, and that's the survival benefit of having it. I mean, not benefit to the humans that are doing it to themselves, but the benefit to the meme.
Yeah, I think it is. I think it is a matter of that. It's a matter of identity. It's a matter of marking yourself and showing your commitment to the tribe. Like, okay, you're gonna are you just gonna wear a kippah? You're just gonna wear a hijab? Well, I'm gonna cut off the end of my dick, right, to show you. But to Brian's point, it's not about just cutting off the end of your own penis. It's people are doing this to their own children. So, and in a way, for them, that's an even bigger. It's like, well, my firstborn son. I have, like, my daughter is 1.5 years old, and when she was born, since then, it kills me, the idea of her going through any kind of pain, even a slight pain. She has a bit of a cough and she gets pink eye. I get depressed. And just the idea that someone would hold them down. And, I know my parents circumcised. They made the decision to circumcise me. And I honestly think I agree with Brian on that. I think they didn't know any better. They thought it was good for me. They didn't know better.
Okay, to be fair, my parents did that to me as well. But they knew, did they not know that you're going through the pain? Because if I show you a video...
No, they don't. They step out of the room. So when we were in medical school...
Yeah, but that doesn't mean... If they got news today, if your parents got news today that your son was captured by ISIS and they were torturing him by cutting off a piece of their finger, right? And then you come home and you say, "Oh, it's in the past. It's okay." They're still fucking sad. Their son was fucking tortured, right? But why are they not feeling that they're doing this to their own babies they're feeling
that they think it's good for them. They think it's good for them. It's I gotta, as much as it hurts me when my daughter cries, when she did get pink eye, we had to put eye drops in her, antibiotic drops in her eye, and she screamed, and it was really, really sad. But I knew that she needed those antibiotics in her eyes, right? I knew that was very important. So they think of this procedure as the same way. They've been indoctrinated and brainwashed into thinking that this is just as important for their kids. So whenever I talk about this, people always say, well, are you insulting me? I chose to circumcise my kid. I always sound like, no, I don't. I actually don't blame you. I think you were a victim of the indoctrination of that whole, cure looking for.
I think there should be. I think there are parents. That's why we don't want to blame them. But maybe they should be blamed a little bit. They could have done a little bit more research, no? Just because
you couldn't. The problem with circumcision is, so I have a friend who is a pediatrician in California. I won't talk to her, but maybe we should bring her on the podcast at some point too. She has told me, she said that, when it comes to like sort of old Jewish and Muslim doctors in the AAP, there's a lot of bias. And these are people, your parents would go up to the doctors, and the leading doctors in this would tell them that this is beneficial. And if you don't do this, something's going to happen to the penis. They're going to get infected. And when they tell them this, I don't blame them. It's really hard to do research on this because there's so much crap research out there, as Brian said. When you have these agenda-driven people like Brian Morris, or dating back to Abraham Wolbarts, who have made all these just ridiculous arguments in favor of this that we now know to be wrong, and the rest of the world is always known to be wrong. In Europe, they always knew that these things were wrong. In Canada, they've always known that it was wrong. So they're the only major industrialized medical body in an industrialized nation in the United States. That's the only major medical body that actually says the benefits outweigh the risks, and that is also very recent. But they stop short of recommending it routinely for all babies, even in the US.
Doesn't this show how fucking influential religion is in our life? And if they manage to get to this, into the scientific community, into affecting so much research, it's just the source is religion and nothing else.
Not the first time. Well, the reason that this topic interests me a lot, the reason that neonatal circumcision, not only because of how I personally feel about it, but also I think this is one example of, when people say, good people do good things, bad people do bad things. Stephen Weinberg said that, but for good people to do bad things, it takes religion.
Yeah,
that's a prime example of Jewish people, even who become completely secular and become atheist activists. Okay, even this is one practice. It's so bizarre. It's such a barbaric, primitive practice. This is one thing that they still hold on to. The nicest, most ethical, most conscientious people in the world will still take a knife to their baby's genitals right when they're born. And it's astounding to me. This is one example to me. I think this is probably one of the best examples of how insidious religious indoctrination is. Right. And that's why I've always been fascinated by it. But go ahead.
Do you see, I don't know how to pronounce his first name, Michal or
I may have mispronounced it before. I called him Michal when we were talking to David Silverman, but maybe it's Michal. I don't know. But either way, Michal or Michal.
I wanted to bring this up. He or she is mentioning the rabbis
sucking the blood. So,
I don't know I think most people know about this, but this actually, most people don't. So can you, Mike. Okay, it's called
Mitzitza B'Pei, right? And this is something I'm bungling the pronunciation. This is something we actually talked to Ari Hershkowitz about. Ari Hershkowitz is the ex-Hasidic Jew who was in a previous podcast guest a few episodes ago.
Right,
was featured in that Netflix documentary, One of Us. Anyway, so he talked about it. And what happens here is this is a Jewish tradition, right, based on their scripture, where the baby, once the baby is circumcised by a moil, not by a doctor, but they have this bris, they have a party where everybody comes in and they celebrate it. The baby is circumcised. Right after that, the rabbi puts the baby's penis in his mouth and to suck the blood. Now, this recently was in headlines in New York City a couple of years ago because Michael Bloomberg, who's also of a Jewish background, was saying that we really need to get rid of this, because there were cases of herpes. These rabbis were giving mouth herpes, and the oral herpes is 80% of the population has it, but they were giving oral herpes to these babies on their genitals. And
so just to repeat that, you cut you mutilate a little kid, and while they're bleeding, you suck their penis to suck the blood out. And you're giving them, so you already had a lot of harm by cutting it. Now you're actually giving them disease, herpes as well. I mean, come on, like nothing other than religion can normalize so much bullshit, can it? Like, can you think of any situation that somebody would just rationally suggest this and people would be like, yeah, I think that's a good idea.
Well, what's interesting is that Ari actually, when we talked to him about it, he said, here's the gradation issue. So when that's what you've known, you're like, oh, that's crazy. Rabbi sucking the penis of a baby and, and all that stuff. So when I circumcise my kid, it's going to be in a hospital. It'll be clean. Oh, and so, so the degree of that they're used to is so bad that they think that, okay, this one thing that is actually really, really horrific in itself is just circumcising the baby at all is going to be an issue. But one analogy that I give is when people say, well, it reduces diseases. And I wrote an article about this on the Good Men Project. I didn't choose the headline. The headline is "Universal Circumcision is the dumbest proposal ever," and I'll put links to these articles as well. I've made a note of it. That supposing after menopause, so after menopause, most women, right? All women, they don't have any physiological function left for their breasts. There's none. Breast cancer is much, much more deadly than HIV and penile cancer combined. Okay, breast cancer is also much, much more common than HIV and penile cancer combined. Okay, so it's more common, it's more deadly. About 1 in 8 women will develop breast cancer at some point in their life. So, would we recommend routine bilateral mastectomies as a removal of breasts of all women after menopause as a way to prevent breast cancer? And the answer to that, most people will be like, that is outrageous. That's ridiculous. Why would you do that? And this is for a non-functioning organ after menopause. And also, it is women making that choice themselves, adult women making that choice. If that sounds outrageous to you, then you have to understand how infant circumcision is even more outrageous.
What you're missing is that God didn't tell you, or you didn't hear voices.
I'm definitely missing the God aspect. I have to tell you, the
God aspect. That's what because if you want to suggest ridiculous bullshit, you have to hear it from God.
Yeah, so
to be accepted.
But I mean, that's the idea. I think with John Kellogg, when Brian mentioned that John Kellogg said that to prevent masturbation in kids, circumcise the boys and apply carbolic acid or phenol to the clitoris of little girls. When he said that, one of those things took hold. The circumcision of boys took hold. Because there's no holy book and no scripture saying carbolic acid on the clitorises of women, of girls, right? So
that would be impressive. That would be impressive, actually. That would be more impressive than most of the things that people claim it's a miracle.
And it didn't take off. That would be if they mentioned carbolic acid in the Old Testament. Can you imagine?
Yeah.
So there are. I mean, there's a lot of misinformation about it. There's all this idea that I think the most important thing that Brian said is people they don't really know what a circumcision is. They just think, oh, okay, it's just a little piece of skin. They don't even know what it is. They've never really seen it. I've seen them. They're huge when they come into the lab. So, and these are baby foreskin. And we haven't even talked about the sort of $1 billion business of skin creams being made from baby foreskin. So baby foreskin.
What? They're making creams out of human body parts?
Skin products, cosmetic skin products from baby foreskins. Google it and they'll find all this information. They actually do that. Because they're going to go to waste anyway, right? So,
oh my God.
There is a lot more to this than people know. And I know it sounds insane. It sounds like the whole tinfoil hat, like it's a theory and, we're just anti-Muslim and anti-Jewish. And, a lot of people are going to say, why didn't you bring a Muslim authority or a Jewish authority on here? And I'm like, well, because they're the least qualified to talk about this. So one thing we need to stop doing is talking to getting the advice and the counsel of Muslim and Jewish authorities when it comes to infant circumcision.
Wait, do the parents have to consent to this before you use parts of the body of their baby?
They just have to consent to the circumcision.
And they don't. So the parents don't know that their baby.
I don't know. Maybe there is a form.
Their baby child was used to put cream on other people's.
I honestly don't know the answer to that, but I know that it's enough of a big deal to.
I'm searching for it on Google. The first thing that comes is a Vice article, but the title is Oprah supporting the harvest of baby foreskin.
Okay, because Oprah. Well, that's a Vice headline for sure. Okay,
yeah, but
Oprah supporting it.
Like think about this. Let's think okay, this is such bullshit. Let's say there's this cult came out that they take little children and they take body parts from the children, the babies, and they turn it into cream and they put it on their face. You would be like, what the fuck? Like, this needs to be like, you would send the cops there, you would stop this, this would be the most barbaric cult that you could imagine. And this is not a cult. This is what most people, this is
how it's done.
This is a big industry, apparently. Like, this shows you the power of religion, that the most barbaric, bizarre, inhumane stuff could be so normalized that you don't even think about it.
Yeah. That is why I'm interested in circumcision. That's why I'm really glad that Maajid is speaking about it now. I'm really glad that more people are talking about it. I wrote my first actual articles focused on this in 2009. Unfortunately, it was in the Huffington Post. It wasn't, but it was actually, it links to a lot of scientific studies.
Jim is pointing out that if you have it, or Jim in our Patreon in the live chat is pointing out, well, if you have it, there's no point to throw it away. You might as well use it. I mean, you already committed the crime, quote-unquote crime. When
you have to understand one thing. So when they do these circumcisions, and I remember we used to do them. I went to medical school in Pakistan. I remember when we used to did our pediatric rotations and we witnessed these circumcisions. The parents left, and the mothers would hear the baby crying inside, and they would be inconsolable. They were just doing it because they thought that it was the right and the healthy thing to do, and it was advised to them by their doctors. That's what you listen to. You listen to your doctor, right? So, it was not, but they couldn't if they wouldn't let them stay in the room.
The fact that you don't remember it, I think, is irrelevant, because it is relevant. But the thing is that whoever the baby was, baby Ali or baby me or baby whoever, that was a completely different individual than me and you. Right? We share nothing with that baby, really.
That's exactly it. Yeah.
So I don't know who that little baby was, but that baby's dead. But you committed. So the fact that I don't remember it doesn't mean that you didn't torture that poor little thing, right? Yeah. That baby is dead because I'm somebody else now. But while it was alive, you made it suffer.
Yep.
Yeah.
You did. So and you're right. I don't think that that's relevant. There are other arguments. Of course, there's the argument that I hear.
That should be enough. Even if there is health benefits, even if there is no harm, even if there is nothing lost, even if it was the fact that you're torturing a conscious being, should be enough for this to be a crime.
Yeah. I think that's a question. It's an ethical. This is at the end. It's an ethical argument. The science and the studies don't support it, because the studies are, again, the latest studies that everybody's salivating over are the ones from the African studies on HIV. And again, those are studies done in adults, and that's not applicable to babies. And I actually completely support the right of any man, any woman to grow up and be of legal age and decide for themselves that they want to be circumcised or cut.
No, there's
also language.
If you're an adult, you have the right to go chop off all your fingers if you want.
Right. Now, I had this. I was on a few years ago. I was on the Joe Rogan podcast, and I talked about FGM there. I had a little segment where I talked about it, and someone heard it, and they were from the Shafi'i sect. So there are 4 schools of thought in Sunni Islam. They're called madhabs. These are the Hanafi, Maliki, Hanbali, and Shafi'i. And in the Shafi'i madhab, FGM is compulsory, right? And that's what I was talking about. It's obligatory in that sect. And that sect is what you have in Indonesia and Malaysia, in places like Egypt and Sudan, where the rates of female genital mutilation are over 80%, over 90% in some cases. So I was basically relating this information I was talking about this on the show, and then this guy responded, one of these Shafi'i scholars, and he was outraged by it. And they played my clip, and they did a podcast episode, and they tagged me in it. And, they said that, you said that FGM is compulsory. FGM is not compulsory. We don't do that. We don't mutilate our daughters. So I listened to it. I was like, okay, I'll hear what he's saying. And the first 2-3 minutes was all about FGM is terrible. We don't do that. It's an invasion of the girl. But cutting is different.
Oh my God.
It's different. That's what we do. We do circumcision and cutting. We don't do the mutilation. And I was like, okay, all right. That's basically what it got down to. So this is the tactic
that I hate when people redefine Muslim, God, or Islam, right?
Yeah.
Instead of addressing the issue, they just redefine it. They're like, hey, we solved the problem.
Yeah, and I one of the things I love that David Silverman said in a couple of episodes ago is that he said that nobody ever worships a God who disagrees with them. If you're pro-choice, no pro-choice person is never going to say my God is pro-life or is anti-choice.
Most people.
It's very rare, Armin.
Some people. I mean, I was a believer. I really wish I could I remember going through hell not doing something that I really wanted to do.
No, that you wanted to do, but you never thought that they were right. Did you actually think, okay, this is something that I really want to do, and it is completely right? And I mean,
that's kind of a tricky question, because if you define what is right based on what God wants, then you have yourself a circular argument, right?
Yeah. I think.
What he's trying to say is most people invent gods that agrees with them, right? But when he said that, I also suggested that it's not only one way; it's two-way. Sometimes you're told that God says this, and you make yourself agree with it.
Yeah.
So
I know. Yeah. Jim King is saying that the lawyer for the doctor who did the FGM in Detroit said it wasn't FGM, it was just a nick. And this is exactly what that Shafi'i scholar was saying. And this is, this is where the discourse becomes very, very difficult, and people actually don't even understand this very much.
Okay, okay, so you're a health professional, so right? So this is what how you get frustrated when somebody says this is not FGM, this is just a nick, and you're just playing semantics with me instead of addressing. You know what my problem is, and you're just changing definitions.
You found a way to bring reform into this discussion.
I did.
Wow, that is passion. That is dedication.
And I'm saying this is a frustration I feel when people know what the problem with Islam is, and instead of addressing the problem, they're just like, hey, let's just change the word.
I agree with you, but that was genius. I gotta say, that was really impressive. But anyway, I think there's going to be a lot more conversation on this to come. We're going to see what happens in Iceland. I guess I'm going to keep on following what Brian's doing. I'm going to keep on following there is a great video actually online about, when we talk about comparing male and female genital cutting with Ayaan Hirsi Ali, actually talking about how the male genital cutting is technically takes away a lot more tissue than female genital. She's a big anti-FGM advocate.
No, but you're talking about Ayaan Hirsi Ali. We asked our patrons guys, if you're a patron, there's now, I don't know, I try to mention this every time. There's a closed Facebook group for patrons only. Only patrons are allowed. And we're having a lot of good discussion. Ali is now going to become more active, hopefully, in the group.
I did as of 2 hours ago. So I have to apologize. My daughter's been sick for the last few days, so I've been attending to her. But I really like the group. I love all the people. I think it's nice to have like a curated discussion that doesn't have anonymous eggs everywhere. So it's a lot more fun too.
Yeah, so the group has been very fun. I've been posting video discussions there, stuff that is going to be only in that group. And one thing I posted in the group was a poll to ask people who they want to see most on this show. And the number one was Ayan Hirsi Ali. But that's going to be tough to get. But if any of you have any connections or know somebody that could talk to her, we'll try our best as well. But that's the number one demanded person by our patrons. And so we'll try our best. But also reach out to us if you do know how we can make this happen, because that would be a great show.
Right, and there are some other people on that list that I saw.
Yeah,
I'm not going to name them right now. I'm just going to wait to see how they respond. But I can reach out to them, so I know several of them. So But
it's good to ask our listeners, because some of them might know somebody that might be able to.
Yeah, absolutely.
They're interested.
I saw somebody on Twitter, and I can't remember who it was. They were actually tagging people and asking them if they would want to talk to us. Yeah,
actually, let's give a shout out. The reason I think why he or she was doing that is because we asked for people to do that. We asked people to go.
And that's really helpful, actually, if you do, because I think Imtiaz Shams replied, and
he replied.
I'm a big fan of Imtiaz Shams.
And Mini and Lily, Twitter handle Lily the Fleur. So she has been. So we asked people to go, and whoever they want to have on our show, go and on Twitter and start bothering them and tell them that if they would be interested, and tag secular jihadists as well, and ask if they would be interested in coming on our show. And we asked somebody and you guys have been doing that, Anne has been doing that, and we already got a confirmation from Imtiaz that he would be interested. So that's been effective. So if anybody go bother the people that you want to see on Twitter, go bother them and tell them that tag secular jihadists, and tag them and ask them if they would be interested in coming on our show.
Yeah. So it's gonna be good.
Maybe the first time they tag you, if they're somebody big, maybe the first time somebody tags them, they're like, oh, whatever, and they see it the third time and the fourth time and the fifth time, like, oh, wow, this is a good show. There are so many fans. Maybe I should consider going on the show. So that might
ended up on other podcasts that way too. People just kept on tagging. I'm like, oh, okay, this looks interesting. These people want to. So it has happened, and it does work. So everything. Anything else you want to say, Armin?
No.
Wrap up.
No, that's good. Yeah. So just if you didn't get a link to the Facebook private group, message me or Ali or message us on Patreon, and I'll send you the link. Please don't add anybody that is not a patron. I keep confusing Patreon with patron. But it's going to be a group just for patrons. But so thank you everybody, Jim, Mike, in the live chat. Frederick left because it was too late, but he asked a very good question at the beginning of the show. So please join this live chat. These questions that you're sending in the live chat, reason on faith, you send us a good question. These questions in the live chat is really helpful. So thank you to whoever showed up on the live chat.
Yeah. I want to address one last thing. Jim King said, didn't Angelina Jolie do it, the bilateral mastectomy, the removal of the breast based on their genetics? Yes, she did. There are these things called BRCA1 and BRCA2 mutations. There are certain genes that they're mutated. They massively increase your risk of breast cancer. So one thing, but we're not talking about that. We're talking about people who just routine, normal people who are otherwise completely healthy.
My mom's mother died from breast cancer when my mom was only 9 years old. So that was...
Yeah, that's rough.
Yeah,
it is. It's rough. It's just. I have a really good friend who's actually undergoing stage 4 breast cancer treatment, and she writes about it and blogs about it a lot. And her, and you guys should follow her. Actually, her name is Uzma Yunus. So, that's
brave of her to talk about it so publicly.
Yeah, she is. She's a physician herself. She's also a doctor. So, and you'll get a lot of really, really insightful, just ideas about what people are going through. She's so articulate and just really, really, really amazing. Just one of my heroes. So,
all right. So I'm going to stop the broadcast.
Yep. I'll see you guys. Bye-bye.
Bye.
The secular jihadists have been made possible thanks to the Illuminati and the covert support of Israel and the CIA. That's what we have been told, but we haven't received our checks yet. If you like what we do, please support us. Share the podcast with your friends. Write and tweet us with topic and guest suggestions. Or head over to secularjihadist.com and give $1 or more for exclusive access to live video. Have your questions read and answered on the air and more. Till next time, may the flying spaghetti monster be with you.